Dear boys, let us do the second part of your Civics second chapter. The name of the chapter is A Role of the Government in Health. When our turn came, the doctor examined me and asked for a blood test. Then we had to go and stand in another long queue. People were crowding around in the testing room too. So, when their turn came, the doctor examined him and asked for a blood test. Then they had to go and stand in another long queue where people were crowding around in the testing room too. So, this is the situation which happened in the government hospital, boys. We got the test results after 3 days and went back to the hospital. There was a different doctor that day. So, after procuring the test result after 3 days, they went back to the hospital to consult with the doctor. But as they went there was a different doctor on that very day. The doctor with whom they consulted before 3 days, that same doctor was not there. Now, the doctor, he said, show me his OPD card and the test results quickly, please. The doctor asked uh, to this gentleman to show his words, OPD card, and the test results very quickly. He seems to be suffering from a bout of viral fever, nothing to worry about. So the doctor said, he seems to be suffering from viral fever. Okay, near about viral fever, but nothing is there to worry about it. All he needs is this one fever reducing medicine. So he need to take a medicine which will reduce his fever. My hospital was nice, but they gave me many medicines and the whole thing cost quite a lot. So, on the other hand, the rich boy, he said his hospital was nice, but they gave him many medicines and the whole thing cost quite a lot. Okay, of course, he need to pay huge amount, but take carefully about his health. Oh, my treatment did not cost much. So the poor boy, he said, his treatment, it did not cost much. Now let us see public and private healthcare services, boy. From the above story, you must have understood that we can roughly divide up various healthcare facilities in two categories. From the above story, which so far we have narrated, there you must have understood here, boys, that we can roughly divide these different healthcare facilities in two groups. The first one is public health services, and the second one is private health facilities. Now, let us see what is this public health services. The public health service is a chain of health centers and hospitals run by the government. Public health service, it is a chain of health centers and hospitals which is run by the government. They are linked together so that they cover both rural and urban areas and can also provide treatment to all kinds of problems from common illness to special services. They are linked. See, in the public health services, they are linked together so that they can cover both village, rural means village, and urban. Urban means city areas, okay, town areas, and can also provide treatment to all kinds of problems from, say, common illness to special services. At the village level, there are health centers where there is usually a nurse and a village health worker. So, in the village level, boys, at the village level, there are health centers, but there is usually a nurse and a village health worker is there who look after the health of those villagers. They are trained in dealing with common illness and work under the supervision of doctors at the primary health center. So they train, see, the health center of that village. Okay, uh, what happened there? The worker, they themselves, they got trained in the dealing with common illness, and they used to work under the supervision of doctors, the primary health center. Such a center covers many villages in a rural area. So these centers, you see, this type of centers, it used to cover many villages in village area. At the district level is the district hospital that also supervises all the health centers. At the district level, the hospitals of district here, what upon at the district level is the district hospital. District hospital used to mention there. That also supervises all the health centers. They also used to look after all the health centers. Okay. Large cities have many government hospitals, such as the one where Aman was taken, and also specialized government hospitals. Large cities, they have many government hospitals. As example, we can say one where Aman was taken, and also specialized government hospitals, such as the ones in Hakim Sheikh's story. The health service is called public for many reasons. Why is that means health service is called public? It has many reasons, boys. In order to fulfill its commitment of providing health care to all citizens. So, in order to fulfill its dedication of providing health care to all citizens, the government has established these hospitals and health centers. The government has established the rise of these hospitals and health centers. Also, the resources needed to run these services are obtained from money that we, the public, pay to the government as taxes. See, also the resources for treatment, whatever it is needed there. Okay, so all the resources needed to run these services are obtained from the money that we, the people, the public, we used to pay to the government as taxes. So, whatever taxes it used to collect by the government from us, they used to utilize these taxes for the resources of hospitals. Hence, such facilities are meant for everyone, and that is why this type of facilities it denotes to everyone. One of the most important aspects means idea, boys. One of the most important idea of the public health system is that it is meant to provide quality health care services either free or at a low cost. One of the most uh, see here, one of the most important idea of the public health system is that it is to give quality health, good qualities, health care services, either it may be free cost or at a low cost, so that even the poor can seek treatment. Okay, it is because of if it is at low cost or free cost, there even poor person also seek the treatment. Poor person also can go for his treatment or her treatment. Another important function of public health is to take action to prevent the spread of diseases such as TB, TB means tuberculosis, malaria, jaundice, cholera, diarrhea, chikungunya, etc. So, another important function of public health is to take action, okay, to take proper action in order to prevent, in order to save the people from the spread of diseases like tuberculosis, in short form it is called TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. Chikungunya, it is a viral disease, boys. This has to be organized by the government with the participation of people, otherwise, it is not effective. So, it has to be organized by the government with the full cooperation of people. If people didn't cooperate there, it is not effective, it will not be successful. For example, when taking up a campaign to see that mosquitoes do not breed in water coolers, rooftops, etc., this has to be done for all houses in the area. As example, when taking up a campaign, okay, when that means a campaign taken up here in order to see that mosquitoes do not breed, okay, from the breeding of say mosquito, different diseases it can be spread there. So to see that mosquitoes do not breed in water coolers, rooftops, etc., this has to be done for all houses in the area, and this precaution should be taken in the whole areas, in all areas, okay, in all houses of that area. Recall the case of Hakim Sheikh. Would you like to know what the court said in this case? So let us recall the case Hakim Sheikh, and that means his party is they didn't get proper treatment at first in different government hospitals, and they filed a case in the court. So what was the reaction there? Let us see. Recall the case of Hakim Sheikh. Would you like to know what the court said in this case? What the court replied in this case? Do you want to know this? According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide health care facilities to all. See our constitution, Indian constitution. Okay, what is constitution? I have already told you in earlier. Okay, boys. It's a set of rules. So in that rules, it has already mentioned it is the primary duty of the government to provide good facilities, the welfare of the people, and provide health care facilities to all. The government must safeguard the right to life of every person. Here, government, they must safeguard, they must look after the people, the right to life of every person, which one of our fundamental right, boys. So it is the duty of government. The court said that the difficulty that Hakim Sheikh had to face could have cost him his life. See, the court give its decision that the difficulty that Hakim Sheikh had to face, it could have cost him his life. Even his life also may finish there. If a hospital cannot provide timely medical treatment to a person, it means that this protection of life is not being given. So if a hospital it cannot give or provide timely medical treatment to a person, that means what? That this protection of life is not being given here. The court also said that it was the duty of the government to provide the necessary health services, including treatment in emergency situations. The court, moreover, it said that it was the duty of the government to provide the proper health services, including treatment in emergency situation, which was happened to Hakim Sheikh. Okay, including the treatment in emergency situations, hospitals and medical staff must fulfill their duty of providing the necessary treatment. They are in the hospital, and their hospitals and medical staff, they also must fulfill their duty in order to provide the necessary treatment those who need. Hakim Sheikh was denied treatment at various government hospitals. Hakim Sheikh was denied. He didn't like treatment at different government hospitals. Therefore, the court asked the state government to give him the money that he had spent on his treatment. And that is why the court asked the statement in favor of Hakim Sheikh. There, the state government has to give him the money that he had spent on his treatment. So this is the decision given by court. Now let us see private health facilities. There is a wide range of private health facilities that exist in our country. So in our India, boys, here we find a wide range of private health facilities. A large number of doctors run their own private clinics. A large number of doctors, they used to run their own private clinics. In the rural areas, one finds registered medical practitioner. Okay, in the village area, boys, one finds registered medical practitioners, RMPS. Medical practitioners means person who work as a doctor, dentist, or lawyer, like that. It is called practitioner. So here, person who works as a doctor, dentist, etc. Urban areas have a large number of doctors, many of them providing specialized services. But in the city area, in town areas, they have a large number of doctors, many of them providing specialized services. Okay, they are well trained. There are hospitals and nursing homes that are privately owned. There are different hospitals and nursing homes which are privately owned. The owner is there, it is not owned by the government. There are many laboratories that do tests and offer special facilities such as X-ray, ultrasound, etc. There are many laboratories also that do tests and offer special facilities like X-ray, ultrasound, etc. Here in our Manipur also, boys, you can see many private hospitals, clinics, okay, laboratories are there. There are also shops from where we buy medicines. Here many shops are also there from where we can purchase medicines. As the name suggests, private health facilities are not owned or controlled by the government. Name itself, it gives the meaning. Civics, as the name suggests, private health facilities are not owned or controlled by the government. It is one's own only. Unlike the public health services in private facilities, patients have to pay a lot of money for every service that they use. So, unlike the public health services in private facilities, patients they need what? They need to pay a lot of money for every service that they use. Today, the presence of private facilities can be seen all around. At present days, the presence of private facilities it can be seen all around of us. In fact, now there are large companies that run hospitals and some are engaged in manufacturing and selling medicines. Medical shops are found in every corner of the country. In fact, actually was now there are large companies which run hospitals and some are engaged in making and selling medicines. Medical shops are found in every corner of the country. Healthcare and equality. Is adequate healthcare available to all? Okay, this question asks to you. Is adequate? Adequate means enough healthcare available to all. Is it so? In India, we face a situation where private services are increasing but public services are not. In our country, India, boys, we face a situation here where private services are increasing day by day, but public services are not increasing. What is then available to people are mainly private services. As public services, it is not increasing. That is why what happened? Uh, the availability to people are mainly private services. These are concentrated in urban areas, and uh, you see these private services. These are mostly you will find showing determination in the city areas. The cost of these services is rather high. So the cost of these services in the private, say hospital or clinic, is rather high. Medicines are expensive. Many people cannot afford them or have to borrow money when there is an illness in the family. Dear boys, every person is not rich, as that means private services these are very expensive. So many people they cannot get this chance to get treatment in the private hospitals, clinic. Okay, it is very hard for them or have to borrow money when there is an illness in the family. They are the poor people, they need to borrow money, okay, for his good treatment. Some private services encourage incorrect practices to earn more. Some private services are there, boys, who used to encourage incorrect practices in order to earn more. At times, inexpensive alternatives, though available, may not be used. For example, some medical practitioners are found to prescribe superfluous medicines, injections, or saline when simple medication may suffice. Here, you see, boys, as example, some medical practitioner here, person who works as a doctor, dentist, etc., okay, are found to prescribe superfluous medicines. Superfluous medicines, superfluous means more than is wanted. Injections or saline when simple medication may suffice. Here, when simple medication means medicine that a doctor has given may be enough for somebody. In fact, barely 20% of the population can afford all the medicines that they require during an illness. In fact, barely hardly 20% boys of the population they can afford all the medicines. They can make availability of all the medicines that they require during an illness. Hence, even for those who one might not think as being poor, medical expenses cause hardship. In this way, boys, even for those whom one might not think as being poor, medical expenses means costing a lot of money, okay, cause hardship. Hardship means the fact of not having enough money, food, etc. It becomes very hard for them, to those poor people. It was reported in a study that 40% of people who are admitted to a hospital for some illness or injury have to borrow money or sell some of their possessions to pay for the expenses. So, as a report was collected, it was reported that in a study of 40% of people who are admitted to a hospital for some illness or injury, they have to either borrow money from any money lender or they have to sell their property. It may be their land or building in order to pay for the expenses which he bear for his treatment. For those who are poor, every illness in the family is a cause of great anxiety and distress. Here you see, boys, for those who belongs to poor family, so every illness, every sickness in the family is a cause of great anxiety and distress. It makes them unrest, okay. What is worse is that this situation tends to happen again and again. So what is bad there? It is that, boy, this situation tends to happen again and again. Those who are poor are in the first place undernourished. So those who are poor, they are always in the first place, okay, of undernourished. Undernourished means in bad health because of not having enough food or enough of the right type of food. These families are not eating as much as they should. So, as they are poor, so these families, they are not eating whatever it is required for their health. They are not provided basic necessities like drinking water, adequate housing, clean surroundings, etc., and therefore are more likely to fall ill. Moreover, you see, boys, here, they are not provided basic necessities, whatever they are required in their life. They are not provided the things like drinking water, then adequate housing means sufficient housing to live, clean surroundings, etc., and therefore are more likely to fall ill, as this more than a necessity, okay, basic needs, these are not available to those people. That is why it is likely more likely to fall ill. The expenses on illness make their situation even worse. So you see, the expenditure on the illness of that person, it make his condition even far worse. Okay, it becomes again more bad for him, his condition, family conditions. Sometimes it is not only the lack of money that prevents people from getting proper medical treatment. Sometimes it is not just only the lack of money which can prevent people from getting proper medical treatment. Women, for example, are not taken to a doctor in a prompt manner. Prompt manner means very quickly, boys. Women, as example, they are not taken to a doctor very quickly. Women's health concerns are considered to be less important than the health of men in the family. Women's health concerns here, some people they used to neglect it, but it should not be wise. Women's health concern, concerns are considered to be less important than to compare with the health of men in the family. Many tribal areas have few health centers and they do not run properly. Many say tribal areas are there, especially in the hilly areas, boys. You will see what that areas have few health centers and they do not get proper health care there. Okay, they do not run properly. Even private health services are not available in the tribal areas. Even private health centers or services, these are not available in those areas. What can be done? There is little doubt that the health situation of most people in our country is not good. So, boys, there is little doubt about that the health condition of most of the people in our India, it is not in good condition. It is the responsibility of the government to provide quality healthcare services to all its citizens, especially the poor and the disadvantaged. See, it is the duty, remember, boys, it is the most important duty for our government in order to give or provide quality, good qualities healthcare services to all the citizens of our country, especially those who are under privileges, okay, or poor, those whose living standard condition is very miserable for them. That means good facilities should be provided by the government. However, health is as much dependent on basic amenities and social conditions of the people as it is on healthcare services. However, health is as much dependent on basic amenities. Amenities means things considered to be essential to make life easier and more pleasure and social conditions of the people as it is on healthcare services. Hence, it is important to work on both in order to improve the health situation of our people, and that is why it is important to work on both in order to improve the health situation of our people. And this can be done, okay, and this can be done, okay, this can be fulfilled. Look at the following example. So my example is here, you see there, the Kerala experience. As example, let us see the from the state of Kerala. In 1996, the Kerala government made some major changes in the state. In the year 1996, the government of Kerala they made some major changes in their entire state. 40% of the entire state budget was given to panchayats. Okay, so in that budget, it was passed that 40% of the entire state budget it was given to the panchayats. Panchayats means local governing body of villages, boys. Panchayat it belongs to villages areas, their government. So panchayat means local governing body of villages. They could plan and provide for their requirements. There that means these panchayats could plan and provide whatever they are required. This made it possible for a village to make sure that proper planning was done for water, food, women's development, and education. So, if financial assistance or budget especially given to that panchayat areas, okay, it will make it possible for that villages to make sure that proper planning was done for water, for food, for women's development and education. This means that water supply schemes were checked, the working of schools and Anganwadis was ensured, and specific problems of the village were taken up. It means here what, that water supply schemes were checked there, the working of schools and Anganwadis was ensured, and specific problems of the village were taken up there. Health centers were also improved. All of this helped to improve the situation. So, after introducing that, health centers were also improved, and all this helped in order to improve the situation, to make the condition better. Despite these efforts, however, some problems such as shortage of medicines, insufficient hospital beds, not enough doctors remained, and this needed to be addressed. So here 40% of entire state budget, though it has given, even and though what happened, uh, however, some problems you see here it pop up, such as shortage of medicines, then insufficient hospital beds. Insufficient means not enough hospital beds, not enough doctors remained as it is, and this needed to be addressed, and it is required to fulfill all these necessities. For more detail, visit one website. It has given here, boys, http is to this one. You enter in this website and you can see it here. Let us look at an example of another country and its approach to issues of health. Let us look at an example of another country, and let us see its approach. Approach means to come nearer, okay, to issues of health. The Costa Rican approach. Costa Rica is considered to be one of the healthiest countries in Central America. Costa Rican, boys, you see, this is there in Central America. Okay, Costa Rica is considered to be one of the healthiest countries in the Central America. The main reason for this can be found in the Costa Rican Constitution. The main reason is there, which is found in the Costa Rican Constitution, their constitution. In that itself it is found. Several years ago, Costa Rica took a very important decision and decided not to have an army. So, several years ago, Costa Rica, they took a very important decision in which they decided not to have an army. This helped the Costa Rican government to spend the money that the army would have used on health, education, and other basic needs of the people. So, as they plan or they made the decision not to keep any army, not to have an army, so the expenditure of that armies, this helped the Costa Rican government to spend that money on health, education, and other basic needs of the people, those who are living there. The Costa Rican government believes that a country has to be healthy for its development and pays a lot of attention to the health of its people. The Costa Rican government, they believe what, boys? They believe that a country has to be healthy for its development. and pays a lot of attention. They need what? To pay good attention towards the health of the people. Then there is the possibilities of development, boys. Here, the Costa Rican government provides basic services and amenities to all Costa Rican. For example, it provides safe drinking water, sanitation, nutrition, and housing. Here, the Costa Rican government provides basic services and uh, amenities, means necessities to all Costa Ricans. As example, it provides safe and pure drinking water to those people who are living there. Sanitation means the equipment and system that keep places clean, especially by removing human waste. Nutrition means the food that we eat and where that it affects our health. And housing, proper housing also to provide people. Health education is also considered very important, and knowledge about health is an essential part of education at all levels. So, health education is also regarded here very important, and knowledge about the health, it is an essential, it is a requirement part of education to every levels. So here is the end of the chapter, boys. You must get through this glossary. Okay, learn this. So here is the end of the chapter. Thank you all.